Red yeast rice is a natural source of lovastatin, and it may lower cholesterol and decrease fat buildup. Red yeast rice is produced when a mold called Monoascus purpuraceus colonizes and ferments rice. The mold turns the rice dark red, and it produces a medicinal compound called monoacylin K. Red yeast rice has been a part of traditional Chinese medicine for over 1,000 years. Today it's sold as a health food and a supplement across the world. Red yeast rice can be brewed in sake, vinegar, wine, and food pickling. In many East Asian countries, it's also used as a red food coloring, for example, in Chinese barbecued spare ribs. Some of the benefits of red yeast rice: it can decrease cholesterol, lower blood pressure, fight cancer, improve metabolic syndrome, prevent complications of obesity, reduce inflammation, and improve bone health. Red yeast rice contains on average 73% starch, 0.8% fiber, 5.8% protein by weight. Its health effects are caused by the compound monoacylin K, the natural form of the cholesterol-lowering drug lovastatin. Monoacylin K is a chemical that's indistinguishable from lovastatin, and it's the main active component of the red yeast rice. The FDA regulates lovastatin, so commercial red yeast rice cannot be sold in the United States if it has more than a trace amount of monoacylin K. However, many red yeast rice supplements do not have information about the monoacylin K on the label, and multiple studies suggest that these supplements may indeed contain significant amounts of this compound. It's currently impossible to know how much monoacylin K that a particular red yeast rice supplement contains without testing it in the lab. The fungus produces several bioactive compounds which may be beneficial to our health. The most important of these are the monoacyls and the pigments. Red yeast rice contains at least 13 monoacyls and several pigments. Monocospelon, a yellow pigment, and rubropunctin, a red pigment, may be used to boost the effectiveness of cancer treatments. Monoacylin K, like lovastatin, binds to HMG-CoA reductase enzyme, and it prevents the production of cholesterol. Red yeast rice doesn't just contain monoacylin K, and its complete mechanism is more complex than lovastatins. According to some research, the other compounds in red yeast rice may in fact reduce the risk of side effects like the muscle weakness. High cholesterol can be a serious health problem and is linked to obesity, insulin resistance, high blood pressure, heart attacks, stroke, and diabetes. The most effective way to control cholesterol levels and to prevent these conditions is to make healthy diet and lifestyle choices. However, some people are prone to high cholesterol regardless of these choices. Red yeast rice lowers bad cholesterol, or LDL, and triglycerides, and it raises good cholesterol, or HDL, in the blood. It may also prevent weight gain and maintain normal levels of liver enzymes and leptin. In multiple studies with almost 8,000 participants, between them, people supplementing with red yeast rice had decreased LDL and total cholesterol with no damage to the liver or kidney function. Triglycerides, like cholesterol, are a type of fatty compound found in the blood. Recent studies have found that triglycerides are more likely than cholesterol to cause heart disease and a stroke. Red yeast rice lowers both cholesterol and triglycerides and measurably reduces the rate of heart attacks. In nearly 5,000 patients who had already suffered a heart attack, long-term red yeast rice supplementation lowered the mortality rates by a third, and it cut the likelihood of future heart attacks in half, from 10% to 5%. In combination with coenzyme Q10, red yeast rice also makes blood vessels more flexible. Stiff blood vessels, especially arteries, increase the risk of plaque forming in the vessels. These blockages can eventually lead to heart attack, stroke, and other complications. Chinese researchers have extensively studied a red yeast rice extract for its anti-inflammatory effects. In 50 patients with coronary heart disease, 1,200 milligrams of the extract per day produced decreased markers of inflammation and triglycerides. In rats with high cholesterol, red yeast rice decreased the expression of genes that cause inflammation. The rats that ate the supplement had decreased levels of TNF-alpha and interleukin-6, two compounds that increase inflammation. Monoacustin, one of the active compounds of red yeast rice, may also inhibit a gene called HDAC1. We don't fully understand how HDAC1 controls inflammation, but the relationship may be responsible for the anti-inflammatory effects. Metabolic syndrome is a collection of conditions including obesity, high blood pressure, high blood sugar, insulin resistance, high levels of triglycerides, and low levels of good cholesterol. People with metabolic syndrome also have increased inflammation and are prone to inflammatory conditions. Red yeast rice can lower cholesterol, blood pressure, and blood sugar. It also has anti-inflammatory and bone strengthening effects. High cholesterol and triglycerides can cause serious kidney damage if left untreated. Through its effect on these fats, red yeast rice protected the kidneys from injury in a rat study. The effects of red yeast rice on healthy kidneys is currently unknown, and furthermore, some red yeast rice may be contaminated with citrulline, which could possibly cause kidney damage. In one study, red yeast rice reduced bone loss in rats with osteoporosis. Animals that were given red yeast rice supplements had higher bone mineral density and healthier bone cells than those without the supplement. A study of white rabbits demonstrated a similar effect. In this study, however, the researchers added a red yeast rice extract to grafts and applied these grafts to a rabbit's skull. The grafts that included red yeast rice extract showed improved bone growth when compared to grafts without the extract. So red yeast rice may increase the expression of the BMP2 gene, which is important for healing of broken bones. Monocuspulin, the yellow pigment in the red yeast rice, can cause the death of prostate cancer cells by inhibiting the mTOR and by increasing AMPK. Through the same pathway, monocuspulin makes cancer cells more sensitive to radiation, and it enhances the effectiveness of radiation therapies. Another pair of compounds found in red yeast rice, rubopunctin and monocolin L, are of interest to cancer researchers also. The rubopunctin may block telomerase, which is an enzyme that allows cancers to metastasize and move to different parts of the body, while monocolin L seems to increase the rate of apoptosis or cell death in the tumor. Some research suggests that combining red yeast rice with other supplements could further improve its benefits and prevent adverse side effects. Coenzyme Q10. Red yeast rice, like lovastatin, decreases levels of the compound coenzyme Q10 or CoQ10, and this is important for maintaining muscle mass and strength. This is why the most common side effect of statins is muscle disease. According to some practitioners, supplementing with coenzyme Q10 alongside red yeast rice may reduce the incidence of these side effects. Healthy fats like rice bran, rather than coconut or sunflower, may further reduce cholesterol buildup while supplementing with red yeast rice. In one study, rats ate a very high cholesterol diet and they supplemented with red yeast rice. The groups of rats fed with the rice bran had far lower cholesterol and oxidative stress when compared with rats fed other oils. Berberine is a compound found in several different medicinal plants. The compound has been part of Chinese and Indian traditional medicine for thousands of years. Berberine is reported to increase LDL cholesterol receptors in the liver, thereby reducing LDL in the blood. In one human study, a a combination of berberine and red yeast rice reduced LDL as much as statin therapy with a much lower rate of muscle damage. Pregnant women should not use red yeast rice. Lovastatin has been associated with birth defects after exposure in the womb. The data is not conclusive, but most researchers caution against using any statin during pregnancy, and this includes monocolin K from red yeast rice. Citrinin is produced by molds and fungi, and is often found in poorly stored foods. Long-term exposure to citrinin can cause damage to the heart, liver, kidneys, and the reproductive system. High-quality red yeast rice does not contain enough citrinin to be dangerous. However, supplement bottles are unlikely to admit the citrinin content, so use caution and always buy high-quality supplements to avoid this toxin. Since monocolin K is the same chemical as lovastatin, people taking red yeast rice and lovastatin may have similar side effects. The known side effects of lovastatin include muscle pain and weakness, nausea, heartburn, headache, and memory loss. Muscle problems are among the most common reported side effect of all statins, ranging from slight pain to severe muscle breakdown. People with existing muscular conditions like myasthenia gravis should avoid red yeast rice. Monocolin K could worsen their symptoms. Lovastatin is also known to suppress the immune system. This property could be helpful for people with autoimmune diseases, but it could also make it more difficult to fight off infections. Other compounds found in red yeast rice may compensate for some of the negative side effects of the monocolin K. People taking red yeast rice as a supplement usually have fewer side effects than those who are taking lovastatin. Some people may have a very rare allergy to Monaskis purpureus. In one case, a young and otherwise healthy butcher developed a severe anaphylactic reaction just from handling red yeast rice as an ingredient for sausages. Few drugs have been specifically tested for interactions with red yeast rice. However, because monocolin K is identical to lovastatin drugs that interact with lovastatin, it should be not combined with the red yeast rice. Verapamil treats high blood pressure, angina, and irregular heartbeat. Red yeast rice and lovastatin both increase the availability and the effect of verapamil. If you're taking verapamil for any reason, you should consult your doctor before supplementing with red yeast rice. Many drugs have demonstrated interactions with statins. These include erythromycin, antifungals, antivirals, cholesterol-lowering drugs, heart medication, warfarin, and immunosuppressants. Therefore, you should talk to your doctor before using any red yeast rice supplement if you're currently taking medication. Like some of the drugs above, grapefruit blocks an enzyme and it prevents statins from being broken down. These statins can then build up to dangerously high levels and cause serious muscle problems. Even a single glass of grapefruit juice with lovastatin could be dangerous. Familial hypercholesterolemia is a genetic condition that causes very high levels of bad cholesterol, LDL, to build up and remain in the blood, regardless of the diet and the lifestyle. This condition is underdiagnosed and undertreated. Genetic testing is not offered in all countries. Familial hypercholesterolemia is often treated with statins like lovastatin. Red yeast rice lowers the LDL cholesterol and may be especially beneficial to people with this disease. Red yeast rice can be eaten as it is, ground up into a powder or purified into an extract. Some red yeast rice supplements are sold in combination with CoQ10, ostensibly to prevent or reduce the muscle damage. If you choose to supplement with red yeast rice, keep in mind that there's currently no way to tell how much monocolin K, citrinin, and other compounds are in each supplement without lab testing. Companies are not required to give this information on the label. Clinical studies use a purified extract of red yeast rice that's guaranteed to contain a certain percentage of monocolins. In one study, 10 milligrams of monocolins per day from purified extract safely reduced cholesterol and prevented harmful changes to blood vessels. It also lowered hsCRP, which is a protein that increases during inflammation. In another study, 2.4 grams of red yeast rice per day reduced cholesterol and blood triglycerides. The correct dosage depends on the purity and the form of the supplement.